Welcome to Deuk Spine Institute. We are performing a right and left piriformis release. Our patient has piriformis muscle syndrome, which is a torn muscle in the buttock called the piriformis muscle. It causes pain at the top of the butt cheek, and we also call it lower back pain. This muscle, unfortunately, once it's torn, it doesn't like to heal. It won't heal. It just continues to hurt until you release it, which I just did. Okay? I'll show you exactly where. Shot. I'm on the back of the femoral neck. All right. You guys see? Show us, Jordan, where the piriformis muscle attaches. Yes. Right there. And I just released it. And it just took that long. And it's all done minimally invasive through a 4mm incision. And I could feel it. It went twang. Let me just make sure there's nothing left. No, that should be it. Let me show you the incision, folks. Go ahead and pull back. Can you guys see this?
Yes, we can.
I'm going to show you all of his pain sources. Give me a marking pen. Okay. He had disc pain, L45, L5S1. L45, L5S1. He had facet pain, 3 facets on each side. Okay? And then he had SI joint pain. He had piriformis pain on the right. He has piriformis pain on the left. So he has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 pain sources. We fixed all of them except for the 5-1 disc, which I couldn't get into. And we're going to do the left piriformis next, and that'll be our last procedure. So the piriformis muscle runs from the sacrum over to the top of the hip, called the greater trochanter, and it attaches to the posterior facet of the greater trochanter. So let's go ahead and make an incision. Shot. Oh wow, look at that. You guys are awesome. Shot. All right, so I'm gonna make an incision over here. Now the incision, the way we do it, it's a 4mm. I pioneered this technique. I'm Dr. Deuk Majan, founder of CEO of Deuk Spine. And we got very successful at fixing back pain coming from a disc injury. It's the Deuk laser disc repair. Then we got successful at fixing back pain coming from a facet joint, Deuk plasma rhizotomy. And all that was left was the piriformis muscle. And I kept sending my patients to the therapist, and they would do therapy for months, and the pain would never go away. It would just keep coming back. The patient kept having pain in their buttock. So I got tired of it. I would send them to a surgeon who would then do an open piriformis release. Well, with an open piriformis release, they cut your entire buttock open. They fillet you open, Sean. And they literally, your gluteus maximus, your butt cheek muscle is gone. It's just a huge, gory, bloody mess. So I started thinking, where could we do the same thing, release the muscle, but not so bloody and painful? And after studying lots and lots of MRIs and medical imaging and anatomy books, I realized the muscle attaches right here to the greater trochanter. And if you use an x-ray, you can find it where it attaches and you can release it. Same way we do everything else. Minimally invasive. So this patient's going to go home. Today we were able to fix 10 out of 11 of his pain sources. So I expect him to have 95% of his pain gone permanently. Every one of these treatments we created here at Deuk Spine. There's 3 different treatments. Deuk plasma rhizotomy for the facets and SI, Deuk piriformis release, and Deuk laser disc repair. And I pioneered them all.
If you're English, you'd say bloody painful instead of
Bloody painful, yeah. Well, welcome. I'm glad you were able to be here. Any questions?
We just have one
Thank you.
question. This comes from Iman on Facebook,
Hello, Iman. Go ahead.
asking, thank you for the live stream. Doc, does all herniated discs need surgery? I have posterior disc protrusion with mild canal stenosis. My mobility and strength is good and only have some sciatic pain, which easily go with a painkiller. I do the exercises on a regular basis.
So let me answer the question. Imam asked the best question all day. Do all herniated discs need to be fixed? The answer is no. Only the herniated discs that cause pain in your back or neck or down your arm or leg. Those herniated discs should be fixed with our Deuk laser disc repair. But any kind of herniated disc that doesn't cause symptoms, leave it alone. Now, how do you know if a herniated disc is causing symptoms? You need me to tell you. Not many doctors can tell you if a disc injury is the cause of the symptoms, but we can at Duke Spine Institute. That's what we do. So thanks for joining us. This was a bilateral piriformis muscle release on a patient with 11 causes of their back pain. We fixed 10 out of 11. I couldn't fix the disc at 5-1 because the facet was too enlarged. I couldn't get there. So, but he's going to do great.